This is a specimen of stomach. The capacity of the stomach is around 1.5 liter in case of adult. Now come to different parts of the stomach. The stomach has an upper end. This is known as the cardiac end, and it has a lower end. Here this is known as the pyloric end. This is the pyloric end. Then it has an lesser curvature above and a greater curvature below. Then it's an anterior surface in front and a posterior surface behind. This is also known as the anterior-superior surface, and posterior is also known as the posterior-inferior surface. This should be the anatomical position of the stomach. This is the upper end, which is directed towards the left side, and this is the lower end, which is directed towards the right side, and the stomach is obliquely placed. So this is the anatomical position of the stomach. This is the cardiac end of the stomach. The cardiac end of the stomach lies behind the left 7 costal cartilage, and it is around 40 centimeter away from the incisor teeth, and it lies around 2.5 centimeter to the left of the midline. And this is the pyloric end of the stomach. The pyloric end of the stomach lies around 1.25 centimeter away from the midline. This is the lesser curvature of the stomach. The lesser curvature of the stomach will give attachment to the lesser omentum. And this is the greater curvature of the stomach. This greater curvature of the stomach, it extends from the cardiac nodes. This part of the stomach is known as the cardiac nodes, just behind the cardiac end. So the greater curvature of the stomach extends from the cardiac nodes. Then it at first runs upwards to form the fundus of the stomach, which reaches the left 5th intercostal space. Then it runs downwards and laterally, and finally reaches the pyloric end of the stomach. So this is the greater curvature. This greater curvature will give attachment to the greater omentum. Now come to different parts of the stomach. The upper part is known as the fundus of the stomach, and the lower part is known as the pyloric part of the stomach, and the remaining middle portion is known as the body of the stomach. Now come to the fundus of the stomach. If we draw an imaginary line that will pass through the cardiac nodes of the stomach, then the part of the stomach that will be left above that line, that means this part, the upper part, will be known as the fundus of the stomach. This fundus of the stomach, it reaches up to the left 5th intercostal space, and it is filled with air. Now how to differentiate the body from the pyloric part? For that we have to identify the incisura angularis. This is the incisura angularis, which is the most dependent part of the lesser curvature. Opposite the incisura angularis, there is a bulging in the greater curvature. This is known as the pyloric antrum. This pyloric antrum has a nodes in the upper part, and it is demarcated from the rest of the pyloric part by presence of a groove in the lower part. So if you draw an imaginary line from the incisura angularis to the nodes that is present on the upper aspect of the pyloric antrum, this line will form the demarcation between the body and the pyloric part. And the portion of the pyloric part that will be present in between this imaginary line and the already present groove in the pyloric part, this portion will be the pyloric antrum, and the remaining portion will be the pyloric canal, and finally the opening will be known as the pylorus. So in this way the stomach can be subdivided. Now come to the surfaces of the stomach. So this is the anterior surface. This anterior surface will be related to the omentum of the greater sac, and posteriorly this is the posterior surface, and this posterior surface will be related to the lesser sac, along with the structures that will form the stomach bed. So lastly I will explain the arterial supply of the stomach. The stomach is supplied by the right and left gastric arteries along the lesser curvature of the stomach, and the right and left gastroepiploic arteries along the greater curvature of the stomach. And the cardiac part is also supplied by the short gastric branches from the splenic artery.